post-lumpectomy. These cases were all post 5 years remission at least. And the one thing we always see when we put it, we see less bruising as opposed to, this is 24 hours later, less bruising in the area, which really doesn't mean too much clinically, but 6 months later you can actually see the scar, which was cut, and you start seeing some blood growth and it's blood vessel growth and a very happy patient. Cosmetically, at least aesthetically, is something that could be given. This was done back in 2007. I think these trials are done and these patients are still being followed up to date. That was a case of 10 patients. In South Korea, we did a lot of case studies for small amounts of breast augmentation. This is a very popular technique in South America, especially in Brazil. We saw a large variability in results by using fat transfer, and what you may mainly see, this is something that was 48 hours later, and that's how many months later. So you still see a bit of volume uptake, not as much volume loss, which is what you usually see with fat transfer. On the face, we had a Turkish cosmetic surgeon who did a number of case studies for us in Istanbul, and you'll see that he did a lot of them on acne scarring, where he was not using fat itself, but was just using the stem cells with the PRP, and it was getting some good results in shallowing out the depth of the acne scars. Another group of plastic surgeons looked, one thing we noticed when we infused cells into patients in other trials, that they had some benefit in hair. The hair was coming out thicker, and it was something that plastic surgeons were quite interested in, so they ran a few case studies. And this required repeated dosing. Once again, it won't grow hair on an egg. You know, it's not going to grow hair where there are no follicles, but it seemed to support the current structure that was there to allow for thicker hair and some follicles not dying off. As you saw before from Korean colleagues spoken, this is where, for diabetic, neuropathic ulcers, you get some amazing results. But you've got to make sure, of course, in a diabetic setting that this is no underlying infection, because these wounds close so fast, and that's 8 days later without a scar. These wounds close so fast that if they've got an underlying staph infection, they're just going to blow up. So it's something that worth looking at. This is a trial we're running, Osteoarthritis Trial, which will be initiated around January, February next year. And what we're looking at is osteoarthritis. There's a lot of push for the use of mesenchyme stem cells, regardless of the source, for intra-articular injection in an osteoarthritic and a degenerative joint model, as our veterinary colleagues would attest to, who've been doing it for a long time, and as Chris here and other people will attest to for the use of mesenchyme stem cells. But this is a classical case where we've just taken the stromal vascular fraction and injected it intra-articularly, and you can see this is the first case study we did in Australia. We've done other case studies which weren't part of the trial, but it's very clear that looking at it 50 days later, you get cartilage regrowth. And that's very important, especially if it coincides with a better movement and less pain and quality on the patient themselves. So there's a very clean indication, and one of the endpoints of the trial is not just to say, oh well, pain decreases. Well, aspirin does that too. Panadol does that. So it's important to know where these fit in the regime of different treatments that is available for osteoarthritis. Nothing beats losing some weight, as sports medicine and orthopedic surgery, losing some weight and doing some exercise. But this may fit in prior to reconstruction, as far as what we're seeing, but the clinical trial will give us more information. And once again, as I said, we can learn a lot of lessons from equine and canine osteoarthritis, as was explored before. Initial case studies from many years ago that we did both in Africa and in Asia, and this is with a group of many doctors who, a lot of these patients were really end stage, so I'm not putting too much, but we can learn from these cases. And another trial we're running, because we did see in emphysema some interesting results in a couple of the case studies. We saw reversal or a benefit in their lung capacity, which is unheard of in very late stage emphysema. So this is one case study we did in Europe on a 3 months to live, very severe idiopathic pulmonary fibrosis case who also had severe emphysema. And this case was done with us at the hospital in Athens with one of the Harvard professor, very well-known IVF specialist, and you can see there's uptake of the cells, and although this scan wasn't too clear, but there was definitely uptake in his cells, uptake in his lungs. This is an IV infusion. He had a 5% reversal in his lung capacity, which is unheard of in IVF. You're better off having lung cancer. You've got a higher chance of surviving than surviving idiopathic pulmonary fibrosis, as you may well know. You've got a 2-year life sentence. So we're running a large formal EU clinical trial, the results of which will be shown at the American Thoracic Society in Colorado, April next year. And so that'll show some interest, but the results, I don't want to talk about the results yet, because Professor Boros here will definitely talk about them then, when it's concluded, but they do seem very promising. Another trial we're running is autism, which is something we never expected to see the results on, but there was a group of paediatric specialists in a major paediatric hospital in Europe who were quite interested in looking at the effects of these cells on autistic children. And there seems to be some positive results so far, but the trial will be finished by the end of 2011. We'll be able to conclude more, but so far there seems to be some positive outcome. One trial we have run and completed was a safety and efficacy trial on type 2 diabetics, because it was something we saw early on, that their glycosylated hemoglobin was dropping in type 2 diabetics. So we did a formal trial, and the end results, because I haven't got too much time to go over everything, is one treatment of an IV infusion. We followed up later on, and we saw that even subcutaneous administration of these cells are giving the same results. But regardless, there was a significant statistical drop in fasting blood sugar, glycosylated hemoglobin, which is really the marker here. It was sustained throughout a year. These patients were followed up for a year, and there was a drop in a couple of the areas in triglycerides. All other markers, all other factors taken into consideration, there wasn't any side effects, any common side effects outside of libido increasing, some weight loss and so forth, but these were anecdotal, but there wasn't any severe side effects. Followed off a year, they're still being followed up, these patients, and so far we haven't seen any significant side effects. Full blood examinations, liver function tests, kidney function tests over those periods of times didn't show anything different. So what's the lesson learned to date? You know, is this snake oil? I mean, what are these cells doing? Are they all going to those areas and having that effect? I mean, we systemically infuse these cells, and this was taken to me when I was presenting some work at the World Health Organization in Cairo, and where they've got a big diabetes unit. If this patient's skin is tightening, he's a diabetic, ischemia, as you saw before, his lung capacity improved, his hair was growing, are these cells doing all this effect? Are they all going to that area and changing as people think? They differentiate? Well, frankly, personally, I don't believe they differentiate at all. I haven't seen good enough data that suggests when those cells go into that area, they differentiate and become fat tissue. I guess it's a good sign, it could be a bad sign, but I have yet to see it even in our own data. What we have seen, though, and what we know, is that these cells secrete, just like all the goodies that are in platelets, these cells secrete a plethora of growth factors and anti-inflammatory cytokines. And so we decided to look at that. Can we find what these cells are secreting? Can we relate it back to the clinical effects? And so really the conclusion, and those derived by others from what I'm seeing in the last conferences I've been to, are these cells multi-drug delivery stores? You're hearing, well, if I give it by IV, I'm getting the same effect as I put a topical. You know, what are these cells doing there? Definitely you can see implantation of these cells in liver, lung, you can see in the pancreas, you can see it in the CNS. We've got some great brain scans anyone wants to see. But are they physically going there and supporting the tissue, or are they implanting somewhere and just secreting? And there's some very good papers done by Mary Rose et al., which shows the point that they can implant there, sit there and secrete their goodies, especially if activated. And so we took on a large study, and once again I'm going to cut a very long story short, where we looked at every single protein from a variety of individuals, what activated, not activated, what are these cells secreting? I want to know the amino acid sequence of everything that's coming out of those cells, and the quantity. Now I won't have time to go over the 480 things we did find, but you'll see things from insulin like growth factor, to tubulin inhibitory factor, to natural